Ah, Shona.
I would start by saying there's very, very clear evidence coming from real world data, so data collected in real time from electronic health records and hospital records, that air pollution is definitely having an effect not just on physical health but mental health. And what we found in our study is that in just over 5,000 people with dementia here in South London, over 9 years, higher exposure to air pollution and generally traffic related air pollution was associated with increased use of mental health services. We were able to compare people at the highest level of exposure to the people at the lowest level of exposure. And to nitrogen dioxide specifically, we found that people in areas of highest exposure were 27% more likely to use these mental health teams. Was look at what would happen in London if we were to reduce levels of nitrogen dioxide down to the World Health Organization recommended thresholds for health. We could reduce use of these community mental health teams by people with dementia by around 38%, which is really considerable. Dr. Backer has pointed out that there can be direct effects of air pollution on the brain, and that also can be indirect and affect the brain through hampering or damaging our physical health. And one way might be through vascular dementia. Air pollution is known to damage the cardiovascular system, and vascular dementia is caused by reduced blood flow to the brain. So it would be air pollution's effects on the cardiovascular system leading to reduced blood flow to the brain.
Pollution increases the severity of mental health service use, and this is in relation to creating a more like kind of wider clinical need around how we can reduce air pollution. However, I mean, in the everyday living, I mean, we call air pollution the invisible killer because there's not something you can see. You can see in the air. It's not something you can quantify. It's not something you understand. So there is recent evidence that they are suggesting that, for example, there could be that very small particulate matter could have a kind of a direct nose to brain pathway, so they can reach the brain via the nasal pathway. All these different pathways that could cause neuroinflammation, which an oxidative stress, which is one of the primary hypotheses that we have for the incidence, for example, of psychiatric disorders. We managed to find effective ways to tackle air pollution and be able to bring down air quality to European Union recommended limits, or World Health Organization recommended limits. This could definitely have an impact on health services as well, apart from the fact of the impact that could have to the public health of the people. The current air pollution level is not for free, so we have severe health and economic impacts that we are observing, and huge societal costs. In order to resolve this, we need to agree how to protect the air quality of our neighborhoods and create a better